Hey, good evening, everyone. I'm Dr. Jenna Scott with Southeast Natural Medicine, and I made a post yesterday afternoon saying that I was going to make a video today to share with you guys a really ridiculous recommendation that I heard that a doctor had told their patient, and I wanted to do a video because it's way too important for just a post because there's so much involved in this. And I asked you to comment below yesterday if any of you all had ever had a doctor give you a ridiculous recommendation, and so many of you did. Thank you for sharing that. It's it's really sad to see the ridiculous recommendations that some doctors give their patients. So what I'm referring to is I had a patient a couple weeks ago who was struggling with low blood sugar after eating. So that's something called reactive hypoglycemia. And I had given her some recommendations. She decided to go see an endocrinologist for more expert advice, which is totally fine. I encourage that. So she went, and then I saw her for a follow-up visit recently, and she shared with me that she had been feeling terrible since following the endocrinologist recommendations. She then proceeded to read off her treatment plan from the endocrinologist and share with me what that doctor had told her. She told her to eat a handful of Skittles every 2 to 3 hours, pretty much for the rest of her life, and that would keep her blood sugar up. I don't use this word lightly, but that was stupid. That was a stupid recommendation. And it may not seem that big of a deal to you, but I want to unpack this a little bit more and share with you exactly why this was not just a ridiculous and stupid recommendation, but actually a dangerous one. Okay? When someone struggles with low blood sugar, it's not that they're not eating enough sugar, it's that they're not eating enough protein and fat along with their sugar or carbohydrates to keep their blood sugar stable. So what happens, they eat a bunch of sugar without enough protein, their blood sugar goes up. That then triggers the body's response to make more insulin, which is a hormone made by the pancreas, to then bring the blood sugar back down. Well, if that happens too quickly because of no protein in that meal or in that snack, then this puts, if you can see my hand here, this puts that person on a blood sugar roller coaster throughout the rest of their day, and you're going to feel terrible when that's happening. So the recommendation by this endocrinologist was eat sugar, just eat sugar, and to limit protein because she told her that the protein would keep her blood sugar too low. That's not just a stupid recommendation. That's false. We have a lot of science, a lot of research proving just the opposite. So this person felt terrible for the past few weeks because she was following really stupid and harmful recommendation. If this patient had continued to do that, meaning to eat Skittles every 2 to 3 hours, a handful of Skittles also, okay? Handful of Skittles every 2 to 3 hours and limit protein, that person would be a diabetic before too long. It's terrible advice. So if you ever are given a recommendation by a doctor and you think like, this just doesn't make sense, or why is the doctor telling me to eat one of the worst foods on the planet? And I use air quotes because Skittles is not even real food. It's so processed. So I just want to share that with you guys. If you ever are told something ridiculous by a doctor, look into it, research it, question it, and challenge it. You do not have to accept what you were told just because the person telling you is a doctor. I will leave you with that, and have a great evening. Bye.